Good afternoon. I'm Michaela Miller with the Monday edition of our City COVID-19 News Show. We will be updating you on the latest information and resources around the COVID-19 pandemic while unpacking deeper issues as they emerge. We encourage you to get in touch with us as we welcome contributions from movements, healthcare providers and our audience. We would like this program to be a two-way flow of information. As the lockdown continues into day 53, the current number of confirmed COVID-19 cases nationally stands at 15,515, with 7,006 recoveries and 264 deaths. The Western Cape has 9,246 confirmed cases of COVID-19, 3,521 recoveries and 156 deaths. The Provincial Health Department has launched an investigation into the death of Khayelitsha Day Hospital healthcare worker. It was alleged that household aide Nolufefe Mdumata died after testing positive for COVID-19. The department was waiting for confirmation on the cause of death, said spokesperson Sitimbiso Magubane. Regional Secretary of Union Nehawu, Zogizane Mabengu, said Mdumata had tested positive for the virus. Two Tygerberg nurses, Ntombazagiti Ngidi and Petronella Antinelli Benjamin, recently died after being diagnosed with coronavirus. An ANC ward councillor and her son are recovering in hospital after being shot by two suspects at their Gombolo Street home in Old Crossroads. The ANC has condemned the attack on 49-year-old Nukatula Buletla and her 13-year-old son. Police spokesperson Lieutenant Colonel Andre Trout said an attempted murder was being investigated and no one had been arrested yet. ANC Dula Umar region spokesperson Nomikosi Dlamini said Buletle and her family were traumatized by the shooting. Meanwhile, police are still searching for the suspects who shot and killed Mfuleni community. Leader Sandile Dlaslisi last week. Anyone with information can anonymously contact Crime Stop on 086 600 10111 or SMS Crime Line on 32211. The Women's Legal Centre has slammed parts of the City of Cape Town's draft amendments to the Streets, Public Places and Prevention of Noise Nuisances bylaw. The bylaw, if passed, could allow law enforcement officials to enter residential homes without a warrant and demand the residents leave of they were contravening bylaws. The centre said that by authorizing a law enforcement officials was the power to effectively effect an eviction from a private dwelling was a harsh procedural consequence and was in many ways nonsensical. An example submitted was that of Isute Nginjana from Blue Downs, who was arrested while taking a selfie on a bench in Sea Point while she passed time before a job interview. The University of Cape Town has released a new study showing that the majority of smokers have been able to buy cigarettes during the national lockdown. The research found that more than 90% of smokers had bought cigarettes despite the tobacco ban. The report also highlighted the excessively high prices being paid, which are completely untaxed. Head of the unit, Professor Corne van Volblik, said although the original intention of the ban was to support public health, the reality right now was that its disadvantages greatly outweigh the advantages. Furthermore, the percentage of people purchasing single cigarettes had more than tripled during the lockdown period, which was a serious problem for public health in South Africa, especially in a post-COVID-19 world. A study conducted by News 24 has revealed that scientists are frustrated over the government's apparent lack of willingness to make a key detailed COVID-19 data accessible. The publication reported that questions are arisen over the health department's apparent stranglehold on access to the geolocated confirmed coronavirus cases, data around testing, screening, contact tracing, and hospitalization data, which included availability levels of medical supplies and high care beds. The data was needed ahead for a meeting of the COVID-19 Ministerial Advisory Committee, known as a MAC, on Monday. The body comprises some of the country's most respected scientists and advises the health department on the best strategy to counter the spread of the disease. Health Minister Zweli Mkhize has denied the claims. We'll be taking a short break now. We'll be back shortly. Welcome back. You're still watching the Our City COVID-19 show with me, Michaela Miller. We will be giving you the latest updates on the COVID-19 pandemic and sharing essential resources and information with you. Inspired by frontline workers, Sindile Mavundla, owner of Culture Cycle Shop in Khayelitsha, has launched a Heroes on Bikes campaign. It provides bicycles to essential service workers as a means of transport during the COVID-19 pandemic. This was not the only way to ensure individuals got to work safely, but also aimed to limit the spread of the coronavirus, but not using public transport forms of transportation. Cape Town TV's Stephanie Pitt has more.
Good day and welcome to the Our City COVID-19 show. This morning I'm joined by Sindile Mavundla, and he is the owner of a Culture Cycle Shop in Khayelitsha and also the founder of Heroes on Bicycles campaign. Welcome, Sindile, and thank you for joining us.
Thank you very much. Thank you for having me, and good morning to your viewers.
So as we start off this discussion, can you tell us a bit more about what the Heroes on Bicycles campaign is all about and when it was started? It sounds like a very interesting initiative, so tell us more about this.
Thank you. So Heroes on Bikes actually was a response on transportation of essential workers to their respective places of work. And this is an idea that I actually thought of, and it was inspired by a campaign that was started in the UK by Brompton. And I was talking to one of my mentors, Peter Cran, and we thought, it will be quite an exciting idea to contribute towards, essential workers by providing them with sustainable transportation, which is perfect for social distancing, and that's cycling. And we then thought, let's start it very small. Let's start with 20 people and see what the response will be. And ideally, we managed to rope in avalanche bicycles in there to actually support or subsidize the bicycles. And so to date, we have managed to get quite a following behind the whole campaign. And we're starting with just 20 people, and we've already raised 10 bicycles. So it's been an exciting journey. And this has been, Heroes on Bikes has been around for like 3 weeks now. And, to have raised almost 25,000, it's fantastic.
Would you say that essential workers now traveling on bicycles will help limit the amount of local transmissions? Because obviously we always see that when people are in a bus or in a taxi, there would obviously be some kind of transmission. So do you think this is a way to curb the spread of the coronavirus?
Definitely. I mean, our thing has been, we have a great opportunity with essential workers. And we need to protect them because, they keep us going. But at the same time, what we wish to show with this campaign is that bicycles are a sustainable mode of transport, and they should be taken such. Yeah. And they give us an ability to transport ourselves while we are able to social distance. And we hope that once we actually are able to provide these 20 bicycles, we'll able to encourage the whole of Cape Town and probably the whole of South Africa to start using bicycles as a mode of transport.
Yeah.
So I think, especially at this time, we have seen in the UK, we have seen, especially in the UK, the government has gone really behind the use of bicycles, and they have invested over 250 million pounds, which is a great achievement in the cycling circle. So we wish to further this, information to our country, to our government, to our people, to say, ride a bike. It's a safer way of doing so.
Yeah, this makes me want to get a bicycle to travel to work. So tell me, what is the process or how does one go about rather to sign up in order to get a bicycle? And what do you need to have in order for you to recognize that someone is essential service and in desperate need of a mode of transport like bicycles?
Fantastic. So we have we have capped already. We have closed currently for the 20. We have already closed the applications. However, we will open them next. So all the details will be on culturecycles.co.za. However, what a person does is to actually simply register, name and number, who you are, what do you do, where do you work, and also we need to verify that information. So you basically, list information of your line manager, so that we are able to actually call the line manager to verify that so-and-so is working at this hospital, for example. And then once we have done so, we then put you on a list. Bicycles are received on a first-come, first-served basis. So if you apply first, you will be the one that is getting the bike before everybody else. So, for example, we have managed to raise 10 bicycles so far. We'll be rolling out those bicycles as of next week, and all of those people that registered first. For example, we have some people in Langa, we have people in that are essential workers. So those bicycles will actually be, will be delivered to them. So it's quite an exciting thing for us to finally get the first 10 out there. But for more applications, we will actually be opening up next week. And we would love to share the information with you once we do, so that you can, alert all the, the viewers of Cape Town TV.
Yeah. So how does one also go about donating bicycles? What is your website or any contact information that people need to know in terms of if they want to get involved?
Fantastic. So we've been very fortunate to have hosted our campaign on the Backup Buddy platform. So anyone that is wishing, any amount actually is really appreciated, because we believe that it's small contributions that can actually, enable us to create or to be able to achieve our goal. So anyone that wants to get behind the initiative can go to backupbuddy.co.za and search for Culture Cycles. And they will make a donation on our Backup Buddy campaign.
Okay.
And more information, they can get in touch with me at Cindile at culturecycles.co.za.
Thank you so much, Cindy. I feel like I need to get a bike, so I might just register as well. And thank you for the viewers of Cape Town TV for watching. Thank you so much for joining us. Have a good day.
Agriculture, Land Reform and Development Minister Toko Didiza has confirmed relief for farmers was on the way. The minister was briefing stakeholders about her department's response to COVID-19. Didiza mentioned that farmers who had applied for government's relief had either received the help already or were in process of doing so. This is what she had to say.
Out of these approved applications, 5,494 are women, 2,493 are young people, and 224 are people with disabilities. The remaining number is 9,542 who are our men farmers. I do want to indicate that though we wanted to reach a 50-50 threshold in terms of gender balance, we're not yet there, but we'll continue to strive that we address this challenge.
Minister Didiza says that an amount of 50,000 would go to a farmer whose request has been approved. The minister, however, stressed that record keeping is a problem for most farmers. She says this made it difficult for farmers to record a turnover.
Each of the approved farmers will receive inputs in line with the size of the farming operation up to a maximum of 50,000. Livestock, I must say, has been the highest commodity requested by farmers at more than 7,000, followed by vegetables at about 3,000 farmers, poultry about 2,500, and the remaining winter crops and fruits 600 and 100 respectively. I must say that as government, we have noted that there are some challenges that our farmers have and we need to address those, particularly the record keeping. A majority of farmers had difficulty in actually confirming the turnover that they derive out of their farming activities. We therefore will be working with farmer organization and some of our government departments to be able to address this challenge. Business development, we will be working with the Department of Small and Medium Enterprises to ensure that indeed we can assist those farmers to run their farming enterprises in an effective way.
Didiza says they now have a clear idea of how many farmers the country has and which category they belong to.
The application process has also enabled us to get valuable data that will go to our farmers register so that we can know exactly how many of our farmers in what categories, where are they farming, and what are they farming with, so that we can actually as a country have a better profile of our farming sector.
For Our City News, I am Stephanie Pitt.
Ayanda Nabe recently sat down with young people from various political organizations to chat about the state of the country in these difficult times. The interview comes in two parts. Here is the first segment.
Hello, my name is Ayanda Nabe, and today we're chatting to the young people, the young politicians, with the interest of hearing their voices in relations to COVID-19. I have with me Inam Kula from the EFF. You'll introduce yourself further, Inam. And I have from the UDM, the national spokesperson, Yongama. Yongama, you also do the same. So shall we start with the ladies? Inam, briefly, who are you in the EFF?
Thank you very much. My name is Inam Kula. I'm the National Treasurer General of the EFF Students Command.
Yongama?
Good morning to you, Ayanda, and to your viewers. I'm Yongama Linet Zikebe. I am the UDM Youth Vanguard National Spokesperson.
Well, at home, if you remember, we've been hearing a lot of talk about COVID-19, especially amongst the politicians, but however, we've not been able to hear the voices of the youth or the youth formations of these particular organizations. Unfortunately, we have tried to invite the ANC, COSAS for that matter, which is COSAS, the student body affiliated to the ANC, and unfortunately they could not join us. We have also tried to invite the Democratic Alliance Youth, and unfortunately they too could not join us. And so we will be talking to the UDM Youth Formation and the EFF Youth Command. Thank you for joining us, guys. So today we wanted to hear your voices. What are young people feeling about the stress of COVID-19? There's been a lot going on. We've heard the many statements about the lockdown. Should the lockdown be uplifted? Is it a fair thing to do? But we've never really heard the youth formations of these political parties speak to us. So what is your view? Shall we start with the Rose, Inam?
Yes, well, thank you very much. I think, look, COVID-19 is uncharted ground, unprecedented. So I think it's been very difficult to everyone, globally. But in terms of the youth and in particular with the students, as we are the student command, I think the difficulty is in how we sort of have to move forward with the academic year. And I think that there have been many different views from the different constituencies, being the Department of Higher Education and Training, the universities themselves, and also the students. So I think the main difficulties is actually like what would benefit the students most, and also even the staff and lecturers, and how to move forward. So as the students command, we basically have reiterated both to the universities and to DHEADs that there must be no students left behind. So this is actually quite difficult when you have universities that don't have the infrastructure or the resources in order to embark on online learning. So some of the previously white institutions, as we have seen, have gone ahead and started what they call online learning, but really it's distance learning, because online learning, you have to be in an environment conducive to your work, which in some cases students are in very vulnerable conditions, where like at home it's not the best condition to actually study in. So we've been like vehemently against this at the EFF Students Command, and has said to the head that they need to ensure that students are in the correct environments, and they're getting resources such as laptops and like data or Wi-Fi services in order to continue with the academic year.
Inam, I'd like to hear what your position is as the UDM Youth Formation. Yongama, sorry.
Yongama.
Yongama,
Oh, okay.
yes. And he's sitting still,
Right.
waiting for it.
um, uh, uh, our feeling is that the government was never prepared. They still aren't prepared. They are going around elter-skelter trying to make ends meet, of which it's a problem, because it's one of the things that we've asked in Parliament last year through our Deputy President, Madam Spanka. He debated and asked that what are the what are the criteria that they've used to say that they are ready for the outbreak in South Africa, because we remember that the president last year and the Minister of Health had said that they are ready for the pandemic, and there were no specifics as to how ready are they into this. Then in Parliament, he asked, how ready are you all? We are saying that you are ready for this pandemic, which is killing China like nobody's business. It's killing people in Italy like nobody's business. But in South Africa, you're saying we're ready, but there's nothing to show that you are ready. When it's social and suddenly you are ready for such a huge pandemic. And there were no specifics till today. There were no specifics as to how ready they are. We're only saying that hospitals are being made quarantine, quarantine areas and whatnot. But there's no data, there's no information that comes out to us young people to say, okay, this is what we are doing. This is how we need our communities to react, or how responsible we need to be as communities. When the outbreak came into South Africa, what we saw was that we were bamboozled into it. We were told in 3 days we are closing the country. I'm like, are you serious? Why are we closing it? What are the basics of you closing the country? How should we then behave as a country? And I think there was that. I always say that President Ramaphosa is not in touch with the people of South Africa so much that he does not even know the fabric of the communities, the behavioral patterns in South Africa. And hence today we are sitting here under a very strict lockdown without any specifics as to where we are going, how we are going to go. Firstly, look at when we entered into level 5. All right, we're in level 5, everybody was home and everything. There were soldiers on the streets and not. We came to level 4, no soldiers on the streets, people in townships and everything they're doing as they please. Where are the soldiers that were deployed? Where is the police that is deployed in order to effectively manage or to enforce the regulations that are out there? Over and above that, there was no awareness. Because if they were ready for the pandemic, they should have had public education awareness out there to tell people this is coming, this is a killer virus, and this is how you need to prepare for it. Because if Ramaphosa is busy consulting everybody else, but not communities, it becomes a problem.
You know,
Because if
I want to come back to you on the issue of the health aspect that you brought in, and of course the visibility of the police and the soldiers. I mean, meaningful visibility. We're not talking about those that we see currently where we find people are being assaulted by these.
We are now taking a short break. We'll be back with more shortly, right after this. Stay tuned. Welcome back. Thanks for staying with us. Let us now take a look at the second part of the interview with Ayanda Nawe and the young politicians.
But I want to just touch base with Inam again on the issue of education. Inam, we've heard one of our ministers stating very clearly that, you know, we will proceed with education in the tertiary institutions according to the state of readiness. Of course, the state of readiness was relying on the fact that they can provide the necessary tools for learners to be able to continue with their study, continue with their academic year. What is your view on this?
I mean, I think that it was disingenuous for both, DHED and the institutions of higher learning. They can ever be ready to continue the academic year online. It's just completely impossible. Don't have the infrastructure, the resources, and even the institutions, the previously white institutions where they have more resources. I can tell you for now that there's still students at the University of Cape Town who have not received their laptops, but I'm aware that they had about 5 tests going on last week. The academic project is continuing and students are being left behind. And then when it comes to the TVET sector, there are TVETs that have been continuing the academic project on WhatsApp and also on Gmail, which is not what students are actually paying for. So I think that this pandemic, in as much as it's unique, it was a time for us to sit down as the different constituencies and stakeholders and sort of do thorough research on how in instances like this we can be resilient as Department of Higher Education and university to be able to continue the academic project in such circumstances and just be able to look at resilience in that way. So I don't think anyone is ready. So to say that we are ready is just basically speaks to the commodification of education. Our universities pretty much like act like entities which just want money out of these things. So yeah, we're definitely not ready as a country to.
I see Yongama nodding. I see Yongama nodding. Yongama, what is your view? What should happen with education from here henceforth?
As much as we so want to save this academic year, come on, guys, it's already and if you look in students from rural areas, deep rural areas whereby there's no network, how are they going to connect to these laptops that are going to be dispatched and so on and so forth? The airtime as well, where are they going to get how are they going to connect with these internet facilities and resources? So we need to also look at that. Or are we going to leave those behind? Of which that's another problem. So our view is that yes, you need to roll out this online. It's not going to happen. Many students are going to be left behind, meaning that the year would be wasted. So how about you prepare the whole year? Let this year go and prepare for another. In 1990, if not 1991, when there was fighting in South Africa and everything, the whole academic year was cancelled. How can we not do the same in this year while we're preparing to say, okay, fine, it is cancelled this year, there's no academic year because already it's late, instead of enforcing matters, then we prepare for next year so that when you come back next year, you come back fully prepared. If a corona is still around, there's PPEs that are ready for the students to convert in their universities. Because how do you then deal with places whereby there's no connectivity and they're still saying that I want to save the academic year? meaning that those without connectivity are going to be left behind. That's the story. Meaning that now, what we're entrenching to say that the norm of inequality, we are stretching it even further in the black government, of which that is not helping anyone. We are fighting inequality in South Africa. We should not by any means be entrenching it.
So, you know, when Yongama, you mentioned something very briefly about the visibility or non-visibility of the soldiers and the police that have been deployed. And you spoke again about the poor health system. And one cannot avoid but link the two in the fight on COVID-19. You'd remember the case of Eastern Cape and all other rural provinces where you find a situation of the infection rate is rising. But at the same time, in social media, what you see is cities, towns and malls that are highly, highly congested, you know. Do you think that there's a link between the two? And do you think that, oftentimes it's very easy for us to throw shadow on the Department of Health. Do you think it's just the Department of Health that's failing? Or do you think there's not, all these departments, particularly in rural communities, are working in silos? What do you think should happen? Just very briefly before we close our show.
But there's no correlation. They're just working in silos, as you say. That one is doing what they think is right, and the other one does their own. That is the problem. Over and above that, if you go to rural areas and these cities whereby, or these towns whereby people are coming out in huge numbers, it's because there was no education in the first place. What has been done in South Africa, we have been put, they've said that we should not panic, but they made us to panic. Soldiers they're not visible. On top of that, if you are enforcing these laws, these soldiers, they needed to be prepared in order for them, when they find situations such as those, they tell people what is at stake, how should they do things and everything. Instead of beating up people and doing all those things, they're the ones now, since they're outside and enforcing the regulations, they're the ones now we should be pushing the education and the awareness to our people instead of beating up our people when they were available. Now they are not available, but they're deployed. Tax monies, the 500 billion is going to them, part of it's going to them, and they're not there. The only thing you find, they're on the end to closing borders and everything, of which where the outbreak is in communities such as Khayelitsha, they are not there.
Inam, very briefly.
Yeah, no, I completely agree with you, Yongam. I understand like why obviously they would need the military in parts, but honestly, we can't continue militarizing the state whenever there's a state of emergency or something like that. I think that the government really could have invested huge amounts into public awareness campaigns, and not just on TV, but really on the ground, get the masses educated and invest in that so that people actually understand what's going on and that they can be better prepared, which then would result in you not needing to bring in so much military cartel into the townships and rural areas. So I'm in complete agreement with you on that.
To my guests, thank you so much for coming to our show. Thank you so much for sharing your knowledge and assisting us in thinking in a very revolutionary way. And we hope to catch up with you next time. And at home, this is the end of our show. But remember, what the young people are saying is that invest in more education. Invest in more education. From me, it's goodbye.
In a media briefing held by the World Health Organization, Dr. Michael Ryan, Executive Director of the WHO's Health Emergency Program, highlighted the effects of coronavirus on the African continent. This is what he had to say.
While the numbers in Africa are well below the rest of the world, and as testing rolls out, we may find more and more cases. It's also been clear in other regions that we've seen a potentially long period where the disease establishes itself, and then a particular moment comes when the disease takes off more exponentially. That time is not well determined, but we are seeing increased activity over the last week in places like Gabon. There's at a 153% increase of cases in just a week. Zambia has equally had a large increase in cases. Chad has increased by over 100%. Benin has increased by over 200%. Now, the numbers remain low, but what's concerning is the trajectory, the direction of travel of the curve. So we need to be exceptionally careful at this point not to underrepresent the potential impact of the disease, while at the same time recognizing that we must maintain other essential health services. We must be extremely sensitive to the fact that lockdowns or very extreme public health and social measures aimed at stopping the spread of COVID-19 have a deep impact on lives and livelihoods. So we have to find a balanced strategy that manages the risks of the disease against the risks to lives and livelihood. And that's something that we've said since the beginning. We've been very, very clear. A comprehensive strategy is not a comprehensive lockdown. A comprehensive strategy is a strategy of surveillance, finding cases, testing, isolating, using quarantine, caring for cases, educating communities, providing access to personal hygiene, practicing physical and social distancing where that can be done, and the use of other measures to reduce transmission of infection. It doesn't necessarily mean high-impact lockdowns that shut down society entirely. And I think many countries around the world, but in particularly African countries, are grappling with this dilemma: how to control COVID-19 while maintaining other essential health services. UNICEF have spoken about this and the likely excess mortality in children that may occur unless we're delivering immunization, unless we continue to deliver food. Henrietta Fore has been very clear on that. David Beasley from the WFP has spoken about the potential issues related to food and hunger as a result of the shutting down of food chains or the loss of food production. So I think in terms of how Africa and African countries deal with this, and again, the Director General may wish to speak, the African Union have very much come together with a comprehensive response plan at the political level. It's great to see that political leadership. I think we're seeing a lot of African leaders step forward, working very closely with our Regional Director, Chidi Muweti, on trying to come up with strategies that are adapted to the social and economic and circumstances of countries. We have issued guidance, very clear guidance on how to adapt the public health control measures that we advise to low-income settings. And we're working very closely with countries at the country level. We have a WHO country office in every country in Africa and are working with our resident coordinators, the UN system, and with ministries of health and other parts of government to try and ensure that we get maximum control of COVID-19 while preserving essential health services. The Director General has spoken about the potential impact on TB, on HIV services, on immunisation and other things. And this is a delicate balance, and it does require help, it does require assistance. In order to be able to do these two things, governments in Africa need support, they need financing. We thank the World Bank for providing financial instruments and others to help them do that. Every country in Africa now has a government national action plan for the containment of the disease, and we call on all donors and friends of Africa to support those national action plans, to ensure that they're adequately financed, and to ensure that especially vulnerable populations within African countries, particularly refugees and displaced persons, are not left behind in this process.
We are taking a short break. When we come back, I will update you on the latest social media. Welcome back. You're still watching the Our City COVID-19 show. Lockdown has resulted in many learning new skills and polishing old ones, from baking to cooking and DIY activities. The City of Cape Town has made a video on how to make a squeeze bottle with a 2-litre bottle, scissors and tubing pipe.
Hi everyone, my name is Kelly and I'm from the City of Cape Town, and today I'm going to show you how to make a squeezy bottle, and it's an easy way to wash your hands, save water, and increase hygiene wherever you are. So what you'll need a 2-liter bottle with a cap, a tubing pipe which you can get at the hardware store, and a scissors or a drill. So what you're going to do next is that you are going to take your cap from your 2-liter and you are going to make 2 holes on top. You can either do it with a scissors or a drill, but remember you need parent or adult or teacher supervision to make the holes. So putting your squeezy bottle together, you're going to take your tubing pipe and you are going to slide it into the hole. It needs to be a little bit tough so that you can ensure the pressure of the bottle at a later stage. So you push it through, then you fill your bottle with water, which I've already done. Place the tubing into the bottle and screw the cap on. There you go. Close the hole above and you're going to squeeze for the water. Release your finger to keep the water flowing. So now that our water's running, I can wash my hands. And the first thing I'm going to do is I'm going to wet my hands. And thereafter, I'm going to use soap, where I am going to fold my hands, as you can see, for 20 seconds. So I can get all of that bacteria off. And while I'm doing it, we can sing Happy Birthday song twice, or we can sing any of our songs. That's going to take us 20 seconds to sing. And thereafter, as you can see, I'm going to rinse all of the germs off. So once I'm done rinsing my hands, all I have to do is lift the tube up for the water to stop, and then I'm going to dry, either shake my hands dry. I can use a clean towel at home or even paper towel to dry my hands, so you don't contaminate or make your hands dirty again if you wipe it on your clothes. So wipe it on your clothes is a no.
And now for social media. Share your thoughts with us on Facebook. We are Our City CT, and on Twitter at Our City CT. These are your popular hashtags on Twitter today. Hashtag Nkanyiso Ngwengwe, the Golden Arrows captain and defender, has died. The 30-year-old centre-back featured 113 times for Mata Mdladla's club, including 101 league appearances during his 7-year professional career. Details on his cause of death aren't clear at this time. After the break, we'll share information and resources and places of safety that you can use during this period. Stay with us. Welcome back. You're still tuned into Our City on the COVID-19 show with me, Michaela Miller. For your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune into Cape Town TV Daily. These are some organizations helping communities stay safe during this period. That's all we have for you today, but if you have something to say, we want to hear from you. Send your comments, news and questions to us via Facebook at Our City CT, on Twitter at Our City CT, or get in touch with us via email on ourcity@capetowntv.org. You can also call us on 021 448 0448. From me, Michaela Miller and the Our City News team, goodbye.